moment, we have a few diseases that once they are mentioned in the society, the entire community stands still as they meditate and ponder upon the mitigation under which they are going to control and bring such ailments to an eradication. Let me talk, for instance, an example of African society and community. We have a disease known as cholera. What is cholera, if I may ask? What comes into your mind whenever you hear of this word cholera, which is a disease and ailment? Remember, cholera does not choose the race and the social rank on whom and whom not to attack. We've seen governors, for instance, entangled in this mystery of cholera. We have as well seen those people who live within the slums of this nation and great world, entangled and found themselves in the same mystery and miserable life of this cholera. What is cholera to speak of? In a nutshell, I am here to unfold the mystery behind this disease known as cholera. First and foremost, cholera is a bacterial infection that is found in certain things that we take, such as water. As you can see, this is water. However, if it's not treated, boiled, or bottled, then, fellow viewers, we are at risk of getting infection of this deadly disease known as cholera. Now, cholera is found in water, and water is used for washing utensils, for cooking food, and as well for washing vegetables and fruits before we consume them. Ensure that before you wash the fruits that you are yet to consume, use clean water that has either been chemically treated, been boiled, or been filtered. By so doing, you're going to eliminate the so-called cholera. Now, what is the source of cholera? Cholera comes to us from a bacteria whose name tantalizes so many of us. Its name is Vibrio cholerae. Vibrio cholerae was initially found within the United States of America in the 1800 years. That is 1800 years. It is 17th century. That is 19th century to be precise. Now, cholera, as I have mentioned, is that it is caused by Vibrio cholerae. That is the cause of cholera. Where is this Vibrio cholerae found? It is found in seafoods such as fish. You can as well find these bacteria in fruits and vegetables. That is, if at all you use water that is contaminated to wash such foods. Most of the time that people who work in streets, as they are called themselves, vendors, they have continuously infected people in the public by selling to them fruits. Before it is peeled, they use the same water that is contaminated to wash the fruits, and that is how the community and the entire public get this deadly disease, which is known as cholera. Now, what are the signs and symptoms of this cholera, if we may mention? Now, Vibrio cholerae, once it has been ingested, of course, through the oral, that is either in water, which is contaminated, and peeled fruits or vegetables that have just been steamed, not cooked properly, or maybe it had been cooked, but you take it while it is cold, then that is the source, or that is how you get the infection of Vibrio cholerae into your GIT, that is gastrointestinal tract. What are signs and symptoms of this Vibrio cholerae which causes cholera? When you have been infected with Vibrio cholerae causing cholera, then the onset of signs and symptoms may be after very few hours, or maybe within the first 5 days. What matters is the immunity strength of an individual that has this infection within. Now, fellow viewers, what should we do upon realization of such signs and symptoms that I'm here to mention to us? For instance, you may have an increased heart rate. When such things happen, vibrio chloride could be one thing that brings that on board. You could be nauseated, that is to say, you feel like you should vomit. You know, there's that effortless diarrhea. Why effortless diarrhea? Because this is something that you took into oral, that it went to the intestine. Upon reaching there, it produces some toxins that do not allow the food to go the normal systematic digestibility. Therefore, you just release it. Remember, it is effortless. Sometimes there may be vomiting or may not be vomiting. Now, let me assume 10 people have been infected by this vibrio chloride, therefore they have cholera within them. Basically, not all of them are going to experience the signs and symptoms of diarrhea, effortless diarrhea, that is, in vomiting. Remember, this diarrhea, sometimes if it becomes severe, it becomes rice diarrhea, rice watery diarrhea. It is effortless. It just comes involuntarily. Most people, on the other hand, they experience mild signs and symptoms, such as abdominal pain. You feel like your stomach is just the way it should be, because there's some issues and problems within. Now again, this depends purely on the age. We have those 5 years and below. For those 5 years and below, it becomes very severe. Why? Because the immunity is not strong enough to enhance the fighting back. Now, whenever you have yourself in such a mess, don't panic. Most of us have continuously panicked, and you find as a result of panicking, you overload your heart, and therefore you bring some shock. But remember, if you find yourself in such a mess of effortless diarrhea and vomiting, your increased heart rate, sometimes sweating a lot, and you feel thirsty, like you feel like you should be taking water each and every time, then remember to visit a hospital to be diagnosed before you undergo medication. Dear viewers, do we have treatment for cholera? Good news is that we have treatment. Cholera is purely treatable. We can use antibiotics, and we can use oral rehydration solution, that is orally through the mouth, and we can use intravenous solution, that is why you are given a drip within your veins to ensure that it goes right inside to at least restore back the water that has been lost. Because remember, as with diarrhea, you lose a lot of water. As you vomit, you lose a lot of water, and as a result, you lose a lot of electrolytes. That is why some people die. How do you die? As you lose this water and electrolytes, then it leads to a shock or maybe a stroke. And remember, this is something that is going to purely affect your heart. That is why we said your heart rate is interfered with and the way in which somebody breathes. Because remember, you're vomiting and diarrhea. Oh my. Then some people, unfortunately, they travel into a long journey that has no return. That is quite unfortunate. Now, what happens if maybe you're far away from the facility and you have found out that maybe you are having vibrio chloride within your system? You can always use salt and sugar, using the tablespoon to make this oral dehydration, that is homemade, and take it. Basically, what you should do during such moments, take a lot of water to keep yourself hydrated, rehydrated, as you're transported through the facility for further diagnosis and medication. Maybe a question that we're asking ourselves is that, do we have immunization or vaccines for cholera? Good news is that we have vaccines and cholera can be vaccinated. However, World Health Organization and Center for Disease Control, that is CDC, does not recommend this, in the sense that, once you have been immunized or maybe vaccinated against cholera, some of us gain such confidence that we go on drinking water that is untreated, we go on eating anything within the streets without actually doing what the necessary by washing hands, ensuring that water is boiled, that fruits are peeled, vegetables are washed before they are cooked. Now, for us to avoid such false confidence, that is why the World Health Organization, otherwise known as WHO, and the Center for Disease Control, known as CDC, does not basically recommend immunization of cholera. Why? Because that vaccine it gives you an immune that lasts for 6 months or so. Now, can you imagine in a year, maybe you were vaccinated once, then that means that your immunity will go back to normal after 6 months. And if you go about maybe not being careful about what you take and what you do, then you're vulnerable and susceptible to this deadly disease known as cholera. It is waterborne in the sense that you can get the bacteria in water, and again you can get it in food. So please, wash your hands well before you eat. After coming from the washroom, that is the toilet to be frank, and ensure that you drink water that is pure, either bottled, boiled, or chemically treated. I know we might be having numerous questions concerning cholera. Basically, this is not exhaustive, but for more details, you can always send me your request or maybe questions in my account, or maybe my YouTube account, or my Gmail, that is jmgugwa@gmail.com. I'll always be ready and willing to answer each and every question that is tabled before me, because this is what we do for the society and humanity. Google Just is my name. Until next time, bye. Stay safe. Cholera kills.